Dear friends, I am Dr. Karthik Ram, cosmetic surgeon from Chennai Plastic Surgery. Today we are going to see that man boobs or the gynecomastia. It's a very common problem among the youngsters and the teenagers. The whole purpose of this video is to completely help them and make them aware that there is a simple and easy solution to cure this whole issue. Lot of good news in the whole video. So patiently please listen to the video. Psychologically, how the guy with the male boobs got affected, nobody can understand. I am going to give you a few examples how much it is psychologically affecting. These are all my own clients' stories, what is happening to each and everyone. And say example, 16-year-old guy, he came to me with a problem of man boobs, probably grade 3 to grade 4. And I asked the parents to wait outside to talk with him what exactly the psychological impact on him. So he never ever removed his shirt even in front of his parents at home. Even the peer pressure, the peers bullying him like anything, and like they criticize to the extent saying that you are not a male, you are a female. He never ever go to a swimming pool or common like the physical education classes where like change the dress in the common dress changing room. He never ever wants to go to these areas. Otherwise, or he waits till everybody changes the dress before he wants to change the dress. So the bright student earlier slowly not interested in his career also. So even parents can't understand what is the issue and teachers can't understand what is the issue. So in this stage he came to me. He don't even want to see his image in the mirror. Every time when he feels his body in the mirror, he kind of feeling like so much depressed. This much amount of psychological impact the guy in the school is undergoing every day. This is not only for you. Lot of people, like every time when we have a school health education program, we can see at least 4 to 5 persons in the same class affected by the gynecomastia. So you can understand how much is the magnitude of the problem. 23-year-old engineering college student, he attempted thrice suicide. Even parent doesn't know what is the problem and even the teachers can't find out what is the problem. Finally one day he opened up saying that I have a male breast issue, I feel very inferior to others. Then the parent brought the kid to me. See the amount of psychological impact the person going through, even up to the suicidal level. 22-year-old male, he feels that he is a female. The last 4 years, from 15-16 years onwards, the man boob started developing. He completely feels that it's kind of changes what he is seeing in his body. So like probably it's a gender issue. So he researched like anything, and he doesn't know whom to convey this message. Even he's shy to tell to the parents or the teachers or whomever. And he has done extensive research about the gynecomastia, even to the extent what a lot of genetic problems what the person normally people undergo, like Klinefelter syndrome, all these things. That level he researched. Finally, he exchanged couple of mails to me. He's kind of suburbs of Chennai, and he exchanged couple of mails and sent photos, and we make him come to the center, and we give extensive psychological counseling to come out of the female image to the male image. And after the correction of gynecomastia, only he is completely changed. Till that time, he suffered like anything, and every day undergoing depression. He can't stick in a single profession. He keep changing the colleges. So it's one of the worst scene I have seen in gynecomastia clients. 32-year-old guy, he keeps postponing the marriage. Parent doesn't know what is the real problem, and even the guy doesn't know there is a solution for a male boobs or gynecomastia. So finally he found out in Google, and he approached us, and we corrected the problem, and in a year's time he got married. the first invitation came to our center. Today, my colleague Dr. Arvind is going to take you to the whole process from the from from the inquiry time to the complete recovery. What are all the possible things possible queries come into your mind? He'll give a complete explanation about the whole gynecomastia process. Guys, don't worry, there is a solution for gynecomastia.
A person who usually comes with a complaint of gynecomastia prefers to meet a male doctor, which is very classical. And when he comes in, we usually examine him in privacy. The most common question that we ask him is just up straight, do you have problem with your chest? They readily accept it, and we proceed on to our examination, where we ask the patient to disrobe and we examine the chest. And most of the time it is just a clinical examination that gives us the diagnosis of a gynecomastia. We do not require any special test in the usual age groups of 20 plus. But sometimes in young children, they need a few blood investigation to just confirm that it is gynecomastia and not any other clinical conditions which might need some medical management. Apart from this, the routine blood investigations and sometimes an X-ray and an ECG are needed for the purpose of an anesthetic fitness alone. After this, the patient is advised to pick up a comfortable date for his surgery, and once he does that, the procedure is taken to the surgery date. Before surgery, there are two very particular instructions that have to be followed. The first is the patient should be fasted for 8 hours. For example, if a surgery is at 8 a.m. in the morning, he should not have had anything by his mouth, even water, for at least 8 hours. That is after 12 in the midnight. Another part of very important instruction is he should have taken bath with an antiseptic solution that we give him the night prior and in the morning of the surgery. And to make sure they have had a light dinner the day before, having quit smoking for at least a week, having avoided alcohol for a few days before, and having made sure that they are taking their proper medication if in case they are having diabetes or hypertension are stressed upon. After that, on the day of surgery, you are asked to come at least half an hour or 1 hour prior to the surgery. You are brought here to the center where we do an initial marking of where we are going to operate. At that time, the site of incision is also marked, which is usually at this level in the shoulder, where a small incision that is around 5 or 6 millimeters is made. Then you are taken to the operating theatre in the hospital. You are made comfortable. A small injection is given in your dorsum of the hand, and with that injection you go to sleep. When you wake up, the surgery is over. In the meantime, what we do is we make that cut here. We go in and do the liposuction, where we remove all the gland and the fat from the whole of your chest. Once that is done, we assess you. We see whether the skin that is at the present time separate from the underlying muscle goes and fits itself properly over your chest. If that is not happening, we make a small cut along the side of your areola, that is the black region surrounding the nipple. Through this cut, we go in, we remove all the excessive capsule of the gland that is left behind and also release it completely from the underlying structure. This would help to evenly drape the skin over the entire chest. So once we do that, we put small stitches at the sides wherever we have made the opening, and we put plasters from the neck to the chest wherever we have done the surgery. So when you wake up at around an hour and a half or 2 after the surgery, you see that you have plasters on your chest. You are pretty awake, you are not drowsy. So we shift you to the room where you made comfortable. You are given something to drink after 2 hours, something to eat another half an hour later. By after 4 to 4.5 hours after the surgery, you are ready to go home. The only instructions on that particular day for you to follow would be to make sure that you are resting properly for the next 2 days without lying down on one side or trying to do any job that requires you to strain. After 2 days, you come back to us when we remove the plasters and we put you on a compressive garment. This garment is specially designed for people who undergo this surgery. It's made up of a material that is very, very convenient and comfortable to wear. And you are supposed to wear it for at least 24 hours, for all the 24 hours in the day for the first 2 months. The only time the garment comes off is when you take your bath or when the garment is washed. Otherwise, you must wear it. The garment serves two purposes. One, it keeps the loose skin properly draped on your chest and very close to the chest muscles so that it sticks to the muscles. Second, it does not allow any free space in the chest so that swelling or blood can get collected there. After 7 days, you are called back to the clinic again when we remove the stitches that have been placed. By the 7th day, you can start driving your vehicle, be it a two-wheeler or a car. Start going for a brisk walk. At around 15 days, you are allowed to go back to your gym where you can start your cardio activities, if possible your ellipticals also, and minor exercises, and by 1.5 months you can go back to your complete routine of complete gym exercises including weights, push-ups, swimming and other things. As far as the results are concerned, for a person who has pretty large breasts, like in a clinical sense grade 3 or grade 4 gynecomastias, the results is pretty evident immediately after the surgery. Around 70 to 85% of the reduction in the size and the shape is visible with the plasters itself. The rest of the space is filled up with swelling, and this swelling takes almost 2 months to go down. So by the end of 2 months, you are attained almost 95 to 100% of your permanent results. So after this time, the garment is to be worn for 8 hours a day, any time that you are comfortable in, and by the end of another 15 days, you are free from the garment also. So as a part of surgery, what are the problems that you get? Rather than calling them problems, I would call them sequels of the surgery. Once the surgery is over and when we remove the plasters on the second day, you would see a little bit of swelling in the place that we have operated. Just like I mentioned before, there is almost a 25% remaining size there. And in people who have a very small gland, it might as if resemble that it is just the same as it was before surgery. This is the swelling part. Apart from this, you will have bruises in the area that we have operated. The third important symptom that you will have is a little bit of numbness underneath the nipple. All these problems are reversible, and at the end of 2 months they are all gone. And as rare complications, what we get is a little bit of skin necrosis along the nipple. If that happens, the nipple goes black. By the end of 2 months, the skin peels off gradually, leaving behind a white skin. This skin will recolor itself to a color that resembles your previous nipple by the end of 3 to 3.5 months. Another rare complication that can occur is formation of small balls, which are essentially scars that form underneath the nipple. If this forms during the routine follow-ups that we have, we notice this, and this is treated by giving you a small injection called Gynecomastia, which will completely dissolve it. So by the end of 2 months, you have a proper result and a good shape in such a way that when you remove your shirt in public or you wear a normal dress, tight-fitting dress, nobody understands or realizes that you have had the problem before, nor would they realize that you have undergone a surgery for gynecomastia. So how does the scar looks at the end of 2 months? Remember that when someone else looks at you, they will not notice it. The scars are in such a way that they are hidden back in nooks along the folds in your axilla. The other scar is merged along the line where the skin and the areola meet. This line as such resembles a scar. So when you take your shirt off, no one will realize that there is something being done there. So this is what happens in a patient with gynecomastia who comes to us. I believe this short video has been informative enough so that you can take your step in getting a good shape. But what I said, the best way to go ahead would be a consultation in person where we can suggest you the best way to go ahead. Thank you, and hope that you can enjoy a better shape of your chest in the future.